Hello, everyone. I'm Stacy Krozik, the Director of Nutrition and Wellness for the American Diabetes Association. I'm passionate about not only how food can support our health, but also how it plays a role in our culture, communities, and celebrations. As a registered dietitian, I often get asked, what should I eat to support my health? Some people struggle to find what works for them, as it's commonplace to see headlines and news stories that often conflict. Today, we hope to provide a bit more clarity as we talk about the intersection of obesity, type 2 diabetes, and cardiovascular disease. We're going to dive into some recent research and talk about some practical applications for healthcare professionals to share with their clients or patients. Our conversation today is sponsored by Avocados, Love One Today, and I'm joined by Dr. Nikki Ford. Nikki, please share a little bit about yourself.
Hey, Stacey, it's great to be here. So, as the Senior Director of the Avocado Nutrition Center, which actually is the only independent hub that's dedicated to comprehensive avocado nutrition research, I lead a fantastic team that focuses on expanding our understanding of how avocados contribute to health. We dive into how nutrients can help manage and reduce the risk for type 2 diabetes, support heart health, assist with weight management, and then also promote overall wellness as we age. We collaborate closely with Avocados Love One Today, which is a resource that's designed to help health professionals stay updated on the latest in avocado nutrition through things like articles, continuing education, handouts, and plenty of other great things.
Well, that is awesome. And before we get started, I would like to start with a fun question, especially since you have access to so many amazing avocado recipes. What is your favorite way to enjoy avocados?
Okay, so kicking it off easy for sure. I appreciate that. So I'd say like the most common way I eat them is really diced on top of everything from soups to salads to sandwiches. It adds that extra creaminess and plenty of extra fiber, but my favorite way is probably the more indulgent way where whenever I'm baking, I substitute avocado for other types of fats in those baked goods. So things like brownies made with avocados, they're super moist and rich. And again, the avocado adds that good monounsaturated fat and the fiber.
Sounds delicious. I think for me, my favorite way, or at least right now, is an egg white veggie omelet over avocado toast. I know it seems kind of ubiquitous, but actually that's a great way I love to start my day. So to help set our conversation today, I'd like to quickly review some recent research and what it's telling us about the big picture. So we know chronic conditions continue to dominate the leading causes of death, and health professionals are continuing to explore programs that promote food as an intervention to reduce the risk of disease. So Nikki, many of the statistics that inform our understanding of the rates of chronic disease in the U.S. come from the National Health and Nutrition Examination Survey. Given your expertise in nutrition research, can you help our listeners understand a bit more about this program?
Yeah, sure. So NHANES, I best basically to better understand the prevalence of disease risk factors in the U.S., we do use something called NHANES. It's the National Health and Nutrition Examination Survey. This program began in the 1960s and it became continuous starting in 1999. It assesses the health and nutrition status of American adults and children through both surveys and physical exams. Using a nationally representative sample of, I think, approximately 5,000 people. And so these mobile centers travel throughout the U.S., and that's what provides researchers with data year after year.
You know what? Thanks so much for providing that context, because I know we rely on a lot of this research to really help understand the bigger picture. And recently, NHANES results were published in JAMA last year and found that there were increases in the prevalence of diabetes and obesity, but no improvement in the prevalence of hypertension. So why does this matter? Having diabetes, hypertension, and obesity can double the risk of developing cardiovascular disease. Historically, research has told us that as we age, our risk of cardiovascular disease, type 2 diabetes, and obesity increases. However, this recent data shows us that the prevalence of these conditions is rising among young adults, which has prompted researchers and healthcare providers to identify gaps in our treatment and the education, right, to help reduce the risk of some of these conditions and identify racial and ethnic communities at higher risk for chronic disease. Additionally, this research also indicated for cardiovascular risk factors that hyperlipidemia declined among the overall population. But the data points to certain populations being disproportionately impacted by certain risk factors. And we're going to talk a little bit more about that. So this close link between obesity, diabetes, and cardiovascular disease makes it crucial for public health programs, health organizations, and clinicians to understand how food interventions can play a role in reducing the risk of obesity, diabetes, and heart disease. One way we at the American Diabetes Association is helping to raise awareness and offer actionable support is our partnership with the American Heart Association on the initiative No Diabetes by Heart to help reduce cardiovascular deaths, heart attacks, heart failure, and strokes in people living with type 2 diabetes. Nikki, I would really love to hear about what some initiatives that Loved One Today is exploring or funding to learn more about this space.
Sure. So first, I want to just start by saying that the Avocado Nutrition Center working with Loved One Today really is unique because we're able to support ongoing research that then provides the evidence between food and outcomes related to obesity, type 2 diabetes, cardiovascular disease. And so this type of research is really critical for healthcare providers to make specific, but also very practical recommendations to patients.
And that's really key, that practical recommendations of really helps us to understand. So as a clinical nutrition researcher, as you've come across of analyzing data, what types of tools do you find that can help support stronger outcomes for patients and clients?
So when it comes to nutrition and food choices, tools that support behavioral changes and those that help people turn advice into action can support a patient's health outcomes. Healthcare providers are often limited on time, especially during patient visits. And so anything that can be sent home with a patient to support them in taking action is really, really valuable. So on loveonetoday.com, there are many free educational materials for healthcare providers. There are meal plans and also patient handouts that you can share with your practice. They're all backed by research and reviewed by dietitians.
That is key. So, I really encourage folks to go check that out. At the ADA, we look for ways for people to meet them where they're at with prediabetes and diabetes and move them along their journey as they build skills. Actually, our nutrition philosophy is informed food choices are essential to living well. And as we, kind of continue to link the impact our food choices to co-occurring conditions, we understand more about the impact and the role of healthy choices, such as fruits and vegetables, in supporting our health goals. What makes our jobs as educators, practitioners, or researchers a bit more challenging is that nutrition is a relatively young science, and more research continues to be released. It's vital for us to stay on top of that latest peer-reviewed and published research and how it contributes to the totality of the science to really help inform our recommendations. This is important because everyone eats. They have a personal experience that influences their passions and their beliefs, and they're very vocal about sharing that, especially on certain social media platforms. But we need to focus on the scientific evidence. Wouldn't you agree?
Oh, yeah. I keep shaking my head the whole time you're talking. Of course, I agree. It's really what I love about my role. I get to stay at the forefront of research. So reading science and engaging with researchers daily. I do this because the ongoing science is really critical to support things like food as medicine initiatives, and also any nutrition recommendations for improving things like well-being or even mitigating risk for different chronic diseases.
Yeah, absolutely. This conversation today is taking place close to Hispanic Heritage Month. It's timely because we know these population groups are disproportionately impacted by obesity and type 2 diabetes. The NHANES study we mentioned earlier also looks at race and ethnic prevalence, and it showed an increase in the prevalence of hypertension among Mexican and Hispanic young adults. And the CDC even reports that Hispanic and Latino people are 50% more likely to develop diabetes at a younger age than non-Hispanic white people. And again, we know that having diabetes, hypertension, and obesity can double the risk of developing cardiovascular disease. So Nikki, as you think about how we can provide practical strategies to support various populations, what does the research say about avocado consumption in type 2 diabetes?
So to date, the Avocado Nutrition Center has supported multiple studies on the consumption of avocados and its link to risk reduction of type 2 diabetes. There's clinical intervention studies that are all fairly short term in length. They're in response to individual meals. They look at alterations in glucose and insulin when avocados are included in those meals. But when we look to our population data, there are really two studies that I'm just going to briefly discuss. The first one I want to highlight, it looked at over 14,000 Hispanic individuals in the US and found that eating avocados is linked to better insulin responses in people with normal blood sugar levels. But when you look at people with type 2 diabetes, avocado consumption was associated with both lower average blood sugar and improved insulin measures. Unfortunately, there was no strong connection found for people with pre-diabetes, but to be honest, I'm not really surprised because that is a pretty diverse group, which actually makes them ideal from the clinical side for working with experts to personalize their diet for management of both glucose and insulin. I do have to mention that this study, of course, is limited because it relied on self-reported diet data, like all nutrition studies. And there are always mathematical challenges in measuring the exact effects. And in this case, unfortunately, diabetes medication use was not captured in this study. So we don't actually know how meds interact with diet. But overall, I would say that this study really suggests that avocados may fit well within many diets. And more specifically, they might help with blood sugar and insulin control. The second study that I want to talk about at the population level comes from April of 2024. It looked at avocado consumption in over 28,000 Mexican adults. And it found that women who ate avocados about 30 grams a day, which is the equivalent of, say, a third of an avocado. Good luck cutting that, but a third of an avocado. Those women had a lower risk of diabetes. So this was true after adjusting for many different things, including lifestyle factors, age, diet quality, etc. However, there was no link found for men. And so because this study is cross-sectional, it means that people aren't followed over time. We're just looking at one time point. This type of work can't really show cause and effect work. But I would say, nonetheless, both of these studies really add to growing evidence that avocados might help with blood glucose and insulin control and really support their role in diabetes prevention.
So that's fascinating. Just a third of an avocado, and that's, like when you were talking about dicing it and putting it up on your soups or on your sandwiches, et cetera. That's very, very doable. And in fact, as you mentioned, avocados are a culturally appropriate food, and this is key to make sure really all our recommendations that we make include cultural foodways. As we think about practitioners now and how they can specifically support their patients and clients, maybe we should talk about some key nutrition recommendations and nutrient considerations we can target in type 2 diabetes, obesity, and heart disease. A key nutrient we focus on is dietary fiber and its importance, because, it not only does it play a big role in promoting satiety, but it also helps us manage both blood glucose and cholesterol. It's also a significant nutrient in need, as only 1 in 10 people in the US currently meet their fiber needs. We know vegetables, fruits, whole grains, and legumes are all important contributors to our fiber intake. And at the ADA, one of the accessible tools we use, especially for people with prediabetes and newly diagnosed type 2, is the diabetes plate. It's a visual representation of a low carbohydrate meal pattern, and it's easy to follow since you're just filling a 9-inch plate, half with non-starchy vegetables, a quarter from lean protein, and the remaining quarter from quality carbohydrates, such as starchy vegetables, whole grains, fruit, and low-fat dairy. Good fats are also a really important consideration, especially as we talk about this intersection of type 2, obesity, and heart disease. So when we think about that, what role do avocados have when considering these key nutrients, dietary fiber and good fats, as well as the diabetes plate?
So avocados are considered nutrient dense. They have nearly 20 vitamins and minerals. They contain fiber and dietary fat, which you already touched on. Dietary fiber is important. But I do want to spend a little bit of time highlighting dietary fats because they're another important nutrient when managing and reducing the risk for type 2 diabetes, as well as its comorbidities. Dietary fats help absorb nutrients. They produce hormones that regulate metabolism in our cells. And if we're not consuming enough, it can really have a negative impact on our health. Avocados contain a source of monounsaturated fats, also known as MUFAs, good fats, which can help reduce bad cholesterol, you already indicated, but also reduce the risk of heart disease and stroke. Dietary fats are overall important for heart health. And interestingly, avocados are essentially the only fruit with good fats.
And they're delicious and versatile too, right?
Absolutely. If I can just take a moment too, I want to quickly hop into the research since that's what I love. In another study published earlier this year, researchers looked at the outcome of over 2,000 adults who ate avocados, and then they followed their health outcomes. They looked at they found lower waist circumference, plasma glucose or blood glucose, and then higher HDL cholesterol. These biomarkers are part of the metabolic syndrome criteria, which when there are abnormal levels combined with high triglycerides and high blood pressure would increase an individual's risk of heart disease, stroke, and diabetes. And so helping patients see improvements in any of these biomarkers will encourage them to continue behavioral changes in order to improve the condition through better food choices. In this study that I was just talking about, participants ate less than one serving. So that's just shy of a third of an avocado again a day. And they saw improvements in overall diet quality. So small changes really can make a difference. And again, this is quite sustainable. It's doable for patients. As an example, naturally, avocados pair really, really well in salads, and they can be part of salad dressing. They can be smoothies with fruits and vegetables. They can be dips with other types of veggies, etc. And so we at the Avocado Nutrition Center supported this research. And of course, lots more studies are needed, but especially since the findings, again, cannot be considered causal and are limited to the self-reported nature of the dietary intake, the data suggests a role, again, for improving diet quality. And it really does demonstrate favorable outcomes for improving glycemic control and maintaining cardiovascular health. I do want to point out that avocados are also considered a culturally relevant food for Hispanic and Latino people. So when meeting with patients to talk about nutrition, clinicians should ask questions to understand the types of foods patients typically consume at home. If clinicians are recommending a Mediterranean diet to a Hispanic Latino patient, it's an unsustainable recommendation due to the taste and flavor differences and maybe the barriers to learning how to cook a new cuisine. So those small changes will have compounding effects. And starting with avocados and seeing where they might fit in with patients is always a good place.
Successful behavior change education starts with the individual and how we meet them where they are, help them move in stepwise and purposeful approaches to inform their own food decisions and support their health goals. So as we wrap up our discussion, it's really important for us to acknowledge that some of the other factors that contribute to our overall health, and each of these alone could be long discussions in themselves. Access to healthy foods, social determinants of health, and the non-nutrient contributions of foods like our culture, community, and celebrations. Additionally, prevention is key for all chronic diseases. Screening, annual checkups, healthy eating patterns, they're all important. So, Nikki, please share some of your final thoughts you would like to leave with our listeners.
So final thoughts. First, really help empower patients and clients by staying on track, by giving them easy to understand handouts, recipes, and other educational materials, especially ones that can go home. When possible, make your recommendations as practical and culturally relevant as possible. So instead of overwhelming them with too much at once, suggest starting with small, manageable changes like adding more fiber, fruits, and veggies into the diet. And then I just want to close by saying that we, again, have a library of free resources on loveonetoday.com that are designed just for healthcare practitioners. You don't need to reinvent the wheel. We've done it for you on Love One Today.
Well, thank you for sharing those talking points, because, really those are really important for practitioners to lean into. And I just want to thank you, Nikki, for this lively and informative discussion, and for Avocados Love One Today for sponsoring this conversation. So please check out the tools and resources on their website, as well as our resources on diabetes.org, diabetesfoodhub.org, and professionaldiabetes.org. Thank you.
Thank you. It's been great seeing you.